Skill 2010, taking someone out of a quick splint, putting him in a rigid splint. Why? Well, for one thing, a rigid splint will give better splinting over time, and it'll probably be more comfortable too. And frankly, it's cheaper to send a piece of cardboard to the hospital than one of our quick splints. In practice, we usually remove the boot in the middle of this, so that's how we're going to demo it to you, even though NSP counts it as a separate skill. The skill guide's a little weird for this one. The CPIs are CMS and then basically putting the splint on, which is kind of odd. So, put the padding in there, get it right, don't screw it up. But the CMS, definitely. Make sure you do that before and after.
Skill 2012, boot removal. This is something that we do pretty much all the time on lower extremity injuries. The only time when we would not do this is in the case of, say, a commutated fracture that's just too painful for the patient to move. In that case, we might even leave a quick splint on and send them to the hospital that way. But it does, removing the boot, as I said earlier, removing the boot can help you with the assessment. And actually, emergency rooms do not practice this skill as we do. So the patient is better off getting the boot removal from a ski patroller than most ER doctors and nurses. We have this technique, we practice it, we can do it without injuring the patient. The hospital will probably just cut their boot off, which, that also works, but doesn't exactly make them popular with the patients. So, some of the secrets to a successful boot removal: unlace and unbuckle. Make sure that everything is undone. And if we're talking snowboard boots with 2 sets of laces, you want them all absolutely loose all the way down. Pull the tongue out of the way, much more so than you ever would putting a boot on or taking it off, and spread the sides of the boot apart. The more you can do that, especially with stiff ski boots that fit tightly, the better off you're going to be. And the final key secret to doing this comfortably for the patient and easily for you is to rotate the boot off the patient's foot. Don't just slide it off, which will pull their foot downward, put stress on their leg, and you know about noise and lawyers, right? The only CPI shown in the skill guide for this one is manual stabilization, although you ought to do a CMS check before and afterwards.
So let's see how that worked. There's our patient, and Dave is assembling the cardboard splint. Notice that the tabs go in from the outside. We reuse our splints in class, so they tend to be a little less stiff than the ones you'll actually see on the hill. He measures it against the patient's uninjured leg to size it and to get padding placement correct. And then this is just mostly an in-class thing. Since we don't want to wreck our splints, we don't tape them as we always do on the hill. So instead, we use this dodge with an extra cardboard splint outside it to hold cravats. And as you'll see in a minute, that makes it easier to get the cravats on there. So Cypher takes stabilization outside the leg. This is the uninjured leg. We practice with that first. So Cypher takes stabilization, and we get the laces undone. We always do the uninjured leg first, just so we get a little practice with this particular boot. And we always ask the patient, is there anything special about your boot? Now the big thing here, as I said before, get it all the way unlaced and get that tongue way out of the way. So now Cypher goes inside the boot to stabilize, puts his chin on the toe of the boot and rotates it right off her foot, lifting only enough to clear the back of the boot. So now the real thing. So here she is, ready to go. CMS check beforehand. Cypher compresses the splint to stabilize it while Dave loosens the straps. And then as Dave takes pressure on the splint, Cypher works her hands in to take manual stabilization. That way, when Dave releases the splint, the patient's leg doesn't move, and it's always held in stabilization. Just as with the uninjured leg now, they undo whatever fixations there are on the boot. Here we've just got laces. Dave backs those laces out super, super, super loose. With a snowboard boot, you don't really have to worry about spreading the shell too much. With a ski boot, you absolutely have to get your hands in there and pry that shell apart. And we'll practice that in class. Pulls the tongue up out of the way. And same deal. Cypher puts stabilization inside the boot. Dave does the thing with the chin, directs the lift, rotates the boot off, smooth as you could possibly expect. Quick Splint gets pulled out of the way, and the cardboard with its pre-positioned cravats goes in. Since boot removal is a skill in itself, CMS check before and afterwards, as you saw there. Cypher lowers the leg into the splint. Dave starts compressing it so that they always maintain stabilization. With a real patient, we'd probably put a lot more padding, especially behind the knee, and we'd fill all the voids in the narrow parts of the leg where they wouldn't meet the cardboard quite as well. So they've got the padding in, and now Cypher can start tying the cravats. Obviously, you don't want to have those cravats tied over the injury itself, and they're doing the fairly easy thing here, which is to tie them over the top. You see Cypher's got that a little offset so that the knot isn't right on the patient's skin. It's mostly impinging on the cardboard. Again, on the hill or in the patrol room, we don't do it this way. Usually we're just using packaging tape. It's faster, it's easier, and you don't leave knots tied against the patient's skin either. So, but for in class, we want to save our cardboards. So, get the last cravat tied. Get it around our stabilizer there. Making sure it's not on the injury and not on the knee. Tie the square knot. It better be a square knot. And a CMS check. And we're done. Now we can pull the guide splint out of the way. That was just to hold the cravats. So there you have it. CMS checks before and after the splint and before and after the boot removal, remember.